It is a little over 1 p.m. on a sunny afternoon in the northern regional capital, Tamale. Ibrahim Dana, a computer technician, is on a lunch break. He finds himself a plate of rice and washes it down with an energy drink. He tells me this boosts his energy level at work.
Sometimes depending on my work, the work I'm doing here, if I just come out a day and I want to do serious work, actually, normally I have to take about 4 or 5. So even if I'm to start work, I have to eat and then take the energy drink. Let's say within a day I can take 4 or 5. Then I'll be able to do my work very well.
This lifestyle is peculiar with many Ghanaians, as no occasion passes without soft drinks being distributed. Available literature suggests that many Ghanaians have replaced water with fruit juice and soft drinks due to its distinct taste and thirst-quenching potential. The Northern Regional Deputy Director in charge of Public Health, Hilarious Abio, says this habit is doing more harm than good.
These practices doesn't improve your nutritional status in any way. In fact, it only adds more health problems because it leads to excess energy, excess calories. And usually what the body would do is to store this excess sugar as fat. If you look at it, most of our diet in Ghana has a lot of carbohydrate inside. You talk about the banku, you talk about the TZ, rice, almost all of them are carbohydrate. And the end digestion is sugar. So to have gone to take a meal of fufu or banku or rice or TZ and go grab a bottle of soft drink is like just flooding your system with a lot of sugar.
Even though there are no specific data on the consumption rate of soft drinks among Ghanaians, public health officials say the consumption is high and can be said to be the leading cause of non-communicable diseases, NCD, including heart disease, diabetes, among others. These NCDs, according to the World Health Organization, are collectively responsible for 70% of all deaths worldwide. In Ghana, health officials say obesity, heart diseases, and stroke is on the rise.
So it's not uncommon to find a number of these people now developing diabetes, and therefore, subsequent to the development of the diabetes, develop things like blindness, develop things like stroke, develop things like heart attack, and things like that, which are becoming very common. Those days, if you have people developing stroke, you are talking about elderly people who are virtually at the end of their lives, 60 years, 70 years. But now you have 30-year-olds, 35 years old with very, very bad hypertension and developing strokes in our hospitals. And if we don't control the consumption of excess sugar, adding of sugars either to our, in fact, even fruit juices, which our people say they have extracted as fresh fruit juices, it's not uncommon to find them adding extra sugar to them to taste. Okay, so whilst you think you are taking fresh juice, you are actually consuming just a lot of sugar. And if we don't control this, we're going to have a lot more of young people, particularly developing obesity, developing all these non-communicable diseases, including stroke, diabetes, and hypertension. And over time, it's going to be a major burden on us.
Ironically, Dana, the computer technician, says after consuming about 4 bottles of energy drink in a day, sleeping becomes difficult at night.
If I go home to sleep, it becomes difficult. And people are telling me it's the energy drink I've been drinking. But normally I don't. It wasn't like that before. But if I get to the house, sleeping becomes difficult. That's the only challenge that I'm facing now.
The Public Health Association of Ghana say they have embarked on a sensitization drive through talk shows and floats to inform the public on the dangers of excessive intake of sugar. But what is the alternative?
A lot of questions people have asked this alternative. What we should know is that your body is made up of 60 to 70% water. Water, and that is, I'm talking of natural water. Your body has 60 to 70% of it. So what you should be doing to your body is replenishing the water. What people have been doing with the sugar sweetened beverages, that they are making an attempt to replenish the water. But once you have sugar in it, it's going to deplete even the water that you have taken, plus more water that you have in your system, because they have to be excreted with a water load. But if you take in normal natural water, you are most likely to meet your body's requirement. So you will be replacing the water. You need to replace our water. Now, I will give you a typical example of, go to the hospital, almost every patient who comes in, they have to infuse saline or water because you are dehydrated. And that is the cause of dehydration. Sugar-sweetened beverages can dehydrate you.
For many Ghanaians, avoiding soft drinks completely might sound impossible, but as officials say, taking it in moderation will reduce the risk associated with it. From Tamale, I am Dinah Ngwan for Citi News.